sarcoma. They just can't tell which type of carcinoma it is. I mean, because we're basing that on basically what it looks like, because that's what it looks like. They do stains of certain criteria that they're pretty well established.
Okay. Yeah, because you had just mentioned that carcinomas usually come from an organ.
Right.
So we think it came from an organ, we just don't know which one.
We're sure it did. If it's a carcinoma, it had to. But we don't know exactly which one, because a lot of times when you do the PET scan, the one advantage of the PET scan is if you have a lymph node that says cancer, we don't know where carcinoma, we don't know where it came from. The PET scan lights up a spot in the pancreas. Go, aha, there's the primary. Didn't show us anything.
Okay.
And so, and in about a third of those patients, you never find the primary. Even if you did an autopsy, you wouldn't find it. You know, so the pathologist is very clear. If the pathologist isn't sure, they'll say, this is probably a carcinoma, but I can't rule out. They say it's a carcinoma, we just can't tell which organ it started from.
Right.
And that's actually this one right here, so I can show you how they word it. So their first report says adenocarcinoma. Adenocarcinoma means a carcinoma that comes from gland-forming organs. So they can at least tell us even an adenocarcinoma. For example, skin is a squamous carcinoma. It's not an adenocarcinoma. So the skin, the upper esophagus, the throat area, the vagina, those are all squamous carcinomas. So they tell us an adenoma, so it's an organ from an organ, and then they can't tell what it is. And they describe it. Tissue, small portion adjacent adipose tissue, that's bad. Some of the tissues show infiltrating carcinoma. These sort of cribiform structures, which you don't see except in adenocarcinomas. So they tend to describe what they see, and that kind of explains why it's an adenocarcinoma. But then they can't show exactly what type it is. Get an addendum after some stains. Well, this is flow cytometry. This is still lymphoma. It's not lymphoma. Let's see. Primarily degenerated and non-hemopoietic cells. Those are lymphomas. Just doesn't have any lymphoma cells. And then when they do the special stains, histochemical stains, they're staining the tissue. Favoring it's an adenocarcinoma. It's metastatic, so it didn't start when they took the biopsy, which we knew. But they say it's probably in the upper GI tract. And here's the stains they did. It's positive for the CK7, CDX10, and MUC5 is focally positive. Those are all suggestive of the GI tract. Mesothelium is mesothelioma, that's negative. CK20 is lymphomas. So they do the stains there to see where it started from.
Now, you said normally when they have bone cancer that they have pain associated with that area?
Just to make sure we're communicating, bone cancer is cancer that spreads to the bone isn't bone cancer. So if you have lung cancer that spreads to the bone, it's lung cancer.
But if they have cancer that's...
If it spreads to the bone, it's usually painful.
Okay.
Not always, but usually. And so these may not be malignant. They probably are just statistically, but with no pain, I'm not so sure. If we were to radiate her spine, I'd first do an MRI to make sure that is destruction of the bone and not an infection or something.
Right.
Back, your side hurt? Okay. I'll get it for you.
See, that's not the right place for the bone.
The lower part?
The part that lights up on the skin is here.
Oh, and this is her veins
Bottom of
down
her
here.
shoulder blade right about here.
We think that's the kidney. Huh?
Yeah.
Mhm.
Probably
It's
is.
your kidney.
Yeah, so hopefully getting a stent will fix that.
Yeah.
Or
The stents are not hard. They're done in the operating room, but they basically go with the scope. They put the stent in, you go on the same day. I mean,
Okay.
it's just not a difficult test to go through.
Okay.
All right.
Okay. Time to sit down and get a thing.
Okay.
I'm getting-
All right, so we'll take it to the lab and get the blood work.
Okay, we're just gonna get
See if we
some
can get this
blood
stuff
work.
done quick and see if we can find some answers pretty
Okay.
fast for you.
Thank you.
Appreciate it.
Thank you.